Yeah, Glenda, and the number that we are breaking down is that one case in our area in Washtenaw County, a child less than a year old. Now, we spoke to a doctor at the U of M. He's not only a pediatrician, he's the chief medical officer for the state community health department. He's got a lot to say about what this one case means for all of us.
What we've heard recently, just over the past few days, is that we've had a confirmed case here in Washtenaw County at the University of Michigan of a child who had Enterovirus D68 and also had weakness in his legs.
U of M pediatrician Dr. Matthew Davis says that child less than a year old with a confirmed case of Enterovirus D68 has been discharged and is resting at home. And like the case in Washtenaw, scores of children with enterovirus are dealing with nerve damage, even paralysis. Doctors say only time will tell if the damage is permanent.
It's really too early to tell what the recovery is going to be, because this is really going to be something that plays out over a matter of weeks and months, rather than just a few days. It's going to be a period where the nervous system requires some time to try to heal up and recover that function that the child had before.
And Dr. Davis says the number of confirmed cases in Michigan is expected to rise.
What we need to understand is that we've had these 25 confirmed cases from the Centers for Disease and Control of Prevention in Atlanta. That is a small subset of all the specimens that we've sent to Atlanta. The over 36 states that now have enterovirus have sent hundreds and hundreds of these specimens, and not all of them have undergone testing.
And the priority, of course, is disinfecting. And the big question coming up for a lot of families is what's going on in schools and daycares? What are they doing to make sure that things are disinfected? And, you know, the question is, should kids even go to places like that? We'll have answers for you coming up in the next half hour of The Now. For now, I'm Andy Choi for The Now Detroit.